Imagine having this severe recurring medical issue, and your doctor's ultimate solution is to intentionally shoot a high-powered laser into your most sensitive tissue.
Right, to literally cause microscopic third-degree burns.
Exactly. I mean, if you're listening to this and wondering why anyone would ever sign up for something like that, the clinical data we're looking at today is going to completely change how you view the body's ability to heal itself.
It really is. It's fascinating.
So welcome to the deep dive. Today we have this massive stack of sources on the table. We've got clinical guidelines, FDA documents, rigorous clinical trial data, and these highly detailed patient consent forms from practices in the US, the UK, and even the Acibadem healthcare group in Turkey.
Yeah, it's a really comprehensive global look.
And the overarching topic is non-surgical vaginal rejuvenation, specifically looking at fractional CO2 lasers and radiofrequency devices. So, you might have heard of brand names like Thermavia or EmpowerRF or Mona Lisa Touch.
Well, those are the big ones.
But we aren't just looking at the cosmetic side today. We're drilling down into one very specific, highly critical question that honestly comes up in every single one of these medical files.
And that is whether vaginal infection should be treated before laser or RF tightening.
Right. Which, on the surface, sounds like a ridiculously simple question with an obvious answer. Like, obviously, yes. But the relationship between these high-tech energy treatments and the natural vaginal flora turns out to be this massive biological paradox.
It really does. The data reveals this cellular relationship that it completely defies, our standard medical intuition of just separating healthy tissue from unhealthy tissue.
Yeah.
To really understand the contradiction we're about to explore, you have to stop thinking of the vaginal environment as just a static anatomical structure. You have to start viewing it as a highly reactive, constantly shifting ecosystem.
And the core contradiction in these documents is just striking. Like, if you walk into a clinic with an active infection, you will get immediately banned from the treatment room.
Oh, absolutely. Hard stop.
Hard stop, yeah. But if you have a documented history of chronic recurrent infections, that medical history might actually make you the perfect candidate for the exact same procedure.
Which sounds completely backwards, I know.
Right. So let's start by looking at that first rigid boundary. Across every single document we reviewed, from Dr. Haleparn's clinical guidelines in San Antonio, Texas, all the way to the international protocols, active infections are a non-negotiable contraindication.
The treatment simply must be postponed.
Right. So why is that consensus so absolute?
Well, the mandate is universal because the risks are just too systemic to ignore. If you look closely at the consent forms, like take the one from your wellness center for the Diva laser, for example.
Got it.
The screening process is incredibly thorough. They aren't just screening for a standard yeast infection. Providers are mandated to look for active fungal, bacterial, and viral infections.
So that includes all sexually transmitted diseases and active urinary tract infections too, right?
Yeah. Exactly. UTIs, STDs, all of it. The sources even carve out very specific warnings for patients with a history of genital herpes, or HSV, because the procedure requires specialized prophylactic management.
Because the thermal energy from the laser is essentially a localized stress test.
Right. Viruses like HSV lie dormant in the nerve ganglia.
Right.
So if you introduce this sudden, intense, localized stress through a laser or radiofrequency heat, you trigger that nerve pathway. And that can provoke a fresh, potentially severe outbreak.
It's basically like painting over a moldy wall.
Oh, that's a great way to put it.
You apply this incredibly expensive, high-tech, fresh coat of paint, hoping to improve the structure, but it doesn't fix the underlying rot. It actually just traps the moisture and forces the mold to spread faster and deeper.
Exactly. And it forces that spread because energy-based therapies rely entirely on hijacking the body's natural immune and healing cascade.
Okay, break that down for us.
Sure. So when an active infection is present, the localized immune system is already fully deployed. It's actively fighting a war against a pathogen, whether that's bacterial or fungal.
Yeah.
Introducing sudden thermal trauma on top of that existing battlefield forces the immune system to immediately divert its resources. It suddenly has to manage emergency tissue repair while simultaneously trying to contain the bacteria.
Oh, wow. So that diversion compromises the local immune response.
Exactly. Which significantly increases the risk of the pathogen multiplying and spreading into adjacent tissues.
You are essentially distracting the guards while the invaders are at the gates.
Yes, precisely.
Which, I mean, that begs the question of what these devices are physically doing to the tissue to require such a massive immune response in the first place. Because fractional CO2 lasers, erbium.YAG lasers, and these RF devices, they don't just magically tighten the area.
No, not at all. They aren't shrinking the tissue like a wool sweater in a hot dryer.
Right. So what is the actual mechanism?
The mechanism relies entirely on creating controlled, intentional thermal damage. But we're talking about micro-injuries.
Micro-injury.
Yeah. The laser energy penetrates the vaginal mucosa and deliberately vaporizes microscopic columns of tissue, creating thousands of tiny, localized wounds.
Which honestly sounds terrifying. But it operates on the exact same principle as microneedling for the skin on your face, right?
Yes, exactly the same concept.
You intentionally cause a tiny injury to force the body into a state of hyperrepair. So the laser tricks the body into launching this massive repair mission.
Right. And the medical terms used throughout these sources are neocollagenesis.
Which literally means building brand new, structurally sound collagen.
Exactly. And neovascularization, which forces fresh blood vessels to sprout in the area.
Okay.
That influx of new blood vessels brings oxygen and nutrients, which is how the vaginal wall ultimately becomes thicker, firmer, and more naturally lubricated over time.
But getting to that thicker, firmer stage requires navigating a pretty critical danger zone, doesn't it?
It does. The aftermath of that controlled injury follows a very predictable but highly vulnerable biological timeline. In the first few days post-treatment, the thermal effect produces localized edema, or swelling, as the body rushes inflammatory cells to the site.
And that's what stimulates the fibroblasts, right? The biological factories that churn out the new connective tissue.
You got it. But during those first few days, the natural defense mechanisms are temporarily offline.
And that danger zone is exactly why the post-treatment instructions from clinics like PRFCT and Dorset Street Dermatology are just intensely strict.
Oh, very strict.
They mandate a period of 3 to 7 days of absolute vaginal rest. So no intercourse, no tampons, no soaking in bathtubs or hot tubs. Nothing is allowed to enter or submerge the area.
Because the mucosal barrier has been intentionally breached.
Right. The sources explicitly warn patients to monitor their bodies for signs of severe escalating infection during this period. They specifically tell you to look for yellowish or greenish drainage, a foul odor, high fever, or severe redness paired with pus.
Which really highlights the immense vulnerability of the tissue in that window.
Yeah, I actually have to push back on the inherent safety of this, though. I mean, if we are intentionally creating thousands of microscopic holes in the vaginal wall, aren't we basically rolling out a red carpet for bacteria to enter the bloodstream?
That is a very valid concern.
Even if a patient feels perfectly fine and doesn't think they have a raging infection, creating a direct pathway into deeper tissue just seems incredibly risky.
Well, the risk of systemic infection from a silent pathogen is precisely why reputable clinics demand an up-to-date, clear pap smear and a comprehensive pelvic exam beforehand.
So questionnaires just aren't enough.
No, absolutely not. The skin's barrier is compromised by design. If an asymptomatic infection is present, say, a low-grade bacterial imbalance, the patient hasn't even noticed those microtraumas, provide a direct, unhindered pathway for localized bacteria or viruses to penetrate much deeper tissues than they ever could under normal circumstances.
Wow.
So the ecosystem must be definitively proven pristine before the laser ever powers on.
Okay, so the hard boundary is established. Active infections are the absolute enemy of energy-based devices.
Right.
But here is the twist in the clinical data that completely upends that logic. While an active infection gets you sent home, the documents reveal that women suffering from recurrent infections, meaning chronic UTIs, or a recurring loop of bacterial vaginosis, are actually heavily targeted as ideal candidates for this exact laser therapy.
Yes. Assuming their current active infection has been temporarily cleared with antibiotics, of course.
Right. Which seems highly counterintuitive, taking a patient whose tissue is already prone to chronic infection and subjecting them to microscopic burns.
I know, but the justification lies in a deep dive into microbiome science and the physical reality of urogenital atrophy.
Let's slow down and look at the anatomy of that atrophy, because it is a devastating domino effect for the body.
It really is.
Often as a result of menopause or even postpartum hormonal shifts, estrogen levels just plummet. And when estrogen drops, the surface layer of the tissue, the vaginal epithelium, thins out drastically.
Yes. The sources describe this atrophy tissue as becoming pale, frail, inelastic, and highly prone to micro-tearing.
And that structural thinning triggers a catastrophic collapse of the local environment, right?
Exactly. As the tissue loses its thickness, there is a massive reduction in the mucus-producing glands. And this lack of lubrication doesn't just cause painful intercourse, it fundamentally alters the chemical pH of the vagina.
Right, because a healthy, resilient vaginal ecosystem is naturally acidic.
Yes, but as the tissue atrophies and dries out, the environment becomes progressively more alkaline.
And an alkaline environment is essentially a luxury resort for harmful bacteria.
Unfortunately, yes.
The tissue is frail, easily torn during daily activities or sex, and the chemical environment is suddenly highly hospitable to uropathogens. It creates this brutal, endless loop of trauma and infection.
A terrible cycle.
So how does shooting a fractional CO2 laser into already frail alkaline tissue fix the underlying biological problem?
Well, it forces a complete structural terraforming of the tissue.
Terraforming, I like that.
Yeah. When the laser induces that controlled trauma and those fibroblasts kick into high gear, the stratified squamous epithelium, that thinned out surface layer, actually rebuilds itself. It thickens.
Okay.
And as that specific cellular layer thickens, it naturally increases the production of glycogen.
And glycogen is essentially the primary food source for the good bacteria in the vagina, right? Specifically the lactobacilli.
Exactly. And when the lactobacilli gorge on that newly produced glycogen, their natural byproduct is lactic acid.
Ah, so the lactic acid floods the environment, bringing the pH back down to a healthy, highly acidic level.
Yes, which naturally kills off the bad alkaline-loving bacteria that cause recurrent UTIs and bacterial vaginosis. We actually have the specific measurements from the ANSES overview, the National Institute for Health and Care Excellence in the UK.
What did they find?
They tracked this exact chemical shift. The vaginal pH dropped from a highly susceptible alkaline 5.82 before laser treatment to a much healthier, more acidic 5.61 after treatment.
That is incredible. It's a profound functional restoration of the ecosystem.
It really is. You aren't just tightening the tissue. You're fundamentally changing its chemical makeup to make it inhospitable to disease.
It's like a controlled forest fire.
Oh, that's a good comparison.
Right. Instead of constantly fighting the individual blazes, you deliberately burn away the weak, dry, atrophied brush. And by causing that controlled destruction, you stimulate the deep roots, forcing a thicker, healthier, and far more resilient ecosystem to grow back in its place.
And that new, dense forest is naturally resistant to the unmanageable wildfires of recurrent infections.
Exactly. And that functional restoration is exactly what researchers are banking on in a major clinical trial right now.
Yes, the sources highlight a specific study, clinicaltrials.gov identifier, NCT04301934. They are actively running a randomized controlled trial testing fractional CO2 lasers directly against standard estrogen creams for postmenopausal women who suffer from 3 or more urinary tract infections a year.
And the stakes for those women are incredibly high because the standard medical protocol for a woman getting chronic UTIs is just a continuous rotating prescription of broad-spectrum antibiotics.
Right.
But the trial details clearly lay out the massive collateral damage of that approach. Chronic antibiotic use wipes out the entire gut microbiome, leading to severe antibiotic resistance.
It's a huge problem.
It leaves these women highly vulnerable to horrific secondary intestinal infections like C. diff colitis, which can literally be life-threatening. The medical community is desperately looking for a way to break the cycle of chronic antibiotic reliance.
Well, the goal of this trial is to prove that the laser can sufficiently improve the urinary and vaginal microbiome, decreasing the colonization of uropathogens simply by restoring the structural thickness and acidic pH of the tissue.
So if successful, it replaces a systemic pharmaceutical intervention with a localized regenerative one, which is an incredible leap forward in how we view these cosmetic devices. But, if you are the patient sitting in the waiting room right now, navigating the clinical reality of this is pretty complex.
It is. We've looked at the high-level cellular science, but the sources are highly pragmatic about what actually needs to happen before a provider ever powers up a device.
Right. A responsible clinician does not just hand over a laser based on a patient's self-diagnosis of, dryness.
No, the clinical protocols demand a rigorous physical pre-assessment. As we discussed, up-to-date pelvic exams and pap smears are mandatory to check for abnormal cells or cervical dysplasia.
But the Acıbadem clinic in Turkey points out a massive red flag that providers must watch out for.
And what's that?
Symptom is a serious underlying infection, or even a severe gynecologic disease like unexplained bleeding, foul discharge, or chronic pain, can incredibly often mimic the standard dryness, itching, or irritation that women simply assume is a normal part of menopause or postpartum laxity.
Oh, wow. Yeah, a patient might book an appointment thinking they just need a quick high-tech laser session to feel a bit more comfortable, completely unaware they have an underlying pathology that requires an entirely different medical intervention.
Exactly. And this brings up a really tricky, dangerous psychological component for the patient.
How so?
Well, think about it. These procedures are often classified as cosmetic, meaning they are rarely covered by insurance. They cost thousands of dollars out of pocket.
Right.
The patient has had to schedule time off work, arrange childcare, and mentally prepare for the procedure. The temptation for a patient to ignore a minor itch or intentionally downplay a mild, unusual symptom just so they don't have to cancel this expensive, highly anticipated appointment is massive.
I see. The sunk cost
The
fallacy.
sunk cost fallacy is incredibly strong in cosmetic medicine.
The psychological pressure to proceed really is immense, which is why the physician must act as an uncompromising gatekeeper. Relying on a patient questionnaire is clinically negligent. The sources clearly document the devastating consequences of treating the wrong root cause. If a provider uses an energy device on an undiagnosed infection, or worse, an autoimmune skin condition like lichen sclerosis, it doesn't just waste the patient's money.
It makes it worse, right?
Oh, much worse. The thermal trauma will actively exacerbate the underlying illness, potentially causing severe prolonged pain, deep tissue blistering, and irreversible scarring. You are taking a delicate diseased tissue and adding literal fire to it.
So there is absolutely no cutting corners. The current state of the ecosystem dictates everything.
The baseline health of the tissue is the single most important variable in both the safety and the efficacy of the procedure.
So synthesizing everything we've pulled from these international guidelines, FDA warnings, and clinical trials, the ultimate rule of this deep dive is really a masterclass in respecting your body's biological timing.
I completely agree.
Active infections must be ruthlessly and completely cleared before any radiofrequency or laser device even comes close to the tissue. You just cannot distract the immune system when it is already fighting a war.
Right.
But once that battlefield is cleared, that very same destructive thermal technology holds incredible regenerative promise. It's not just about a superficial cosmetic tightening.
No, it's about fundamentally rebuilding the vaginal walls at a cellular level.
Exactly. Kickstarting the production of glycogen, lowering the pH through lactic acid, and actively keeping future infections at bay by creating an inhospitable environment for disease.
It requires a profound paradigm shift. We have to stop viewing these tools merely as cosmetic erasers and start recognizing them as powerful instruments of regenerative medicine.
We really do. And, as we wrap up this deep dive, there is one final implication of this research that is really worth pondering.
Okay, what is it?
We spent this whole time talking about treating existing problems, clearing active infections, reversing severe atrophic thinning, and trying to stop the endless loop of chronic UTIs in postmenopausal women.
Right.
But if these energy devices can functionally restore a youthful, acidic, and highly resilient ecosystem by forcing the body to rebuild its own cellular structure.
Oh, I see where you're going with this.
Right. What happens if we stop waiting for the ecosystem to collapse in the first place? Could a low-level, less invasive version of this laser therapy eventually become a standard preventative part of entering menopause?
That is a wild thought.
Much like we take calcium and vitamin D to proactively prevent osteoporosis before our bones become brittle, could future generations use preventative light and energy therapy to maintain their microbiome, completely bypassing the painful biological realities of urogenital aging?
It fundamentally changes the timeline of women's healthcare.
It really does. So, next time you hear about a cosmetic laser, remember the controlled forest fire. The exact same technology used to burn away the old might just be the key to ensuring the new ecosystem never fails.